Hi, good afternoon. This is Jaya. I come to you from this beautiful afternoon in West Palm Beach. I'm sitting on my back porch, as you will see, happy and smiling and healthy. But I come to you to share something with you today. I normally tell you about what I do as a coach and a health coach, but I want to share with you my story as a patient of diabetes, patient of metabolic syndrome, thyroid issues, PCOS, a whole lot of things. So I want to talk to you as a patient. It is really important that you understand where I'm coming from. So I'm going to share my screen because I want to tell you my story. And I speak my story with a lot of pictures and some real life numbers, if you will. So many times when I talk to someone who is seeking help, the first question they ask me is, how much is it going to cost me? And so many times I tell them that what is the cost of doing nothing? So I want to show you or delaying your decision. What will it be the cost? So I want to share with you my struggles and my story. Not just about whether I can run Disney 10K today, which I can, versus how I feel today, my energy, but cost. Let's talk that as we go along. So let me share my screen and I'll tell you the story. Real story. Very painful story. But I think it is an important story to share. It's my perspective as a patient, not as a salesperson, not as anything, not a coach, just a patient. Okay? I'm going to share my screen so you can see what I'm talking about. There you can see me today, I hope. But I'm going to talk about cost of a lifestyle and more importantly, cost of doing nothing. So yes, that was me, June 17th, 2015. Yes, less than 3 years ago. And this was me now, as you can see, took about a year to do what I wanted to achieve. But let me tell you the story, how I got to that 2015 and where I was at. So we are all born healthy. I knew it. I'm an MD. I'm a doctor. I'm supposed to know, and I did know. I taught pathology. I taught physiology. I taught public health. I taught people what health means and what it means to be healthy. I was walking 10,000 steps a day. I'm a vegetarian, so lacto-vegetarian, so I wasn't eating red meat and butter and all those things and dolaps. No, I didn't have a Taco Tuesday or pizza night, and yet I was unhealthy. Knowledge was there, but it wasn't sufficient. I had diabetes, I had full-blown metabolic syndrome, I had thyroid issues, and I was 220 pounds. I was way overweight. And I didn't get there in one day. It crept up on me. But 7 years prior to that picture that you saw me, I was officially diagnosed with diabetes. Way many more months and years before that, I was pre-diabetic. And I was trying and trying and trying. And I was seeking help. I knew where my current health path was, but I didn't know the solution. I wanted to find that new health path, but I didn't know how to get there. I knew the forecasted path was for me if I didn't do anything about it at all. Knowledge was there, but I didn't have a solution. I knew all this stuff. I knew it. My dyslipidemia, hypercholesterolemia, my non-alcoholic fatty liver disease, metabolic syndrome, type 2 diabetes, polycystic ovarian syndrome, asthma, GERD, all of these, degenerative joint disease, all of these were related to this fat that I was carrying around my middle, and I didn't know how to get rid of it, or I would get rid of it just to regain it back because I did not know how to keep off the weight. I didn't know what I was doing wrong. So, what was I doing? Where was I? This is where I was. I was taking medications. None of them prescribed by me, but my doctors who were trying to help me. A whole host of slew of alternative healthcare practitioners who gave me all these wonderful supplements to have. Still not healthy. If you see closely, all those bottles have my name on it. Jaya Prakash. All those supplements cost me a lot of money. And you look at that blue box at the back, and right next to that, that open thing, that was my ventilator right next to my bed, because if I stopped breathing at night, I needed to give that ventilator albuterol treatment myself, because I didn't have to then drive down to emergency room. And in the emergency room, when I had a serious asthma attack, I had to wait for 2 hours to get treatment. So my doctor, I loved her very much. She prescribed this machine for me that I could administer the treatment myself. That was my reality. But most importantly, let's talk about cost. Let's talk costs. I had insurance. I wasn't uninsured. I had insurance. These were my costs of all the medications I took, all those different things that I had to do. And this was just medications and supplements, nothing more. And I underestimated the supplements because I didn't want to scare everybody away. I told them, oh, I buy one, get one free deals. If there are internet deals for 15% off, I buy supplements like that. I went to prescriptions with the cheapest generics I could find, but many of them were not generic. There was no generic for Advair. There was no generic for prescription strength Allegra. There was no generic for any of the anti-diabetic medications. So after the first year card was over, that $5, $15 copay card was over, I was paying $50 as my copay because there were no generics for it. And just mere generics there was not enough. So I was still not healthy and was paying just for medications and supplements $465 a month. And then I had such a wonderful, wonderful acupuncturist. He used to be my student and my colleague and then my clinician. And he was so kind and he was so helpful for my diabetic neuropathy, so I could actually walk and stand and talk as a professor. He treated me for just $40 a month. Sometimes once, sometimes twice, but he never just said, no, Jaya, I'm going to, no, this was his kindness. I had to use a special hydration cream because my skin was so dry I couldn't even hold on to the clicker when I was lecturing properly. And I had this wonderful Chinese herbalist and massage therapist. Again, I loved my doctors very much, all both traditional and alternative therapist. And he used to again treat me for just $60 a month. And I used to see a nutritionist. Again, I loved her. She tried very hard. She gave me these meal plans and I followed them religiously, and that was $175 once a month because the insurance would only cover certain portion and not all of it. And I did a variety of diet programs because I thought my food was all wrong. So yes, every diet program that you have heard of, I did that. I did Jenny Craig Nutrisystem. I did Slim Fast. I did all of them, and then some special formulated nutrition plan for me. I did all of them, and I paid program fees. I went for the meetings. I went online meetings. I did all of those, and I'm conservatively estimating the cost to be 325. I'm sure it was more than that. I'm not even counting the gas that it took me to go to those meetings and those places and pick up the food and all of those things. I'm not even count the cost of food. This is just the additional cost. So let's see the total costs. The monthly cost of just keeping me alive and going, not healthy. My A1C was more than 7. It was 7.68. I still had diabetic neuropathy. I still had metabolic syndrome. I still weighed 220 pounds and I was miserable. And yet my monthly cost was $790. So per year cost was $9,480. And I did this for 7 years in one form or the other. So let's see the staggering cost, 66,360, and this is a conservative estimate, and I'm not counting my food. What do you think this figure means to me? A single mom with a fixed income and a child in college. That was the cost of keeping me alive and going, but not healthy. Still not healthy, right? I wish somebody had connected me to a solution sooner. And I'm not even talking about the hidden costs. Behind that wonderful smile was mental anguish, depression, feeling of hopelessness, anger. I wasn't angry at my doctors. They were trying their very best, but they didn't know. They didn't know the solution. Insurance companies did not give me the solution. They gave me diabetes education, but not true solutions. I used to literally lose my thought process because of hypoglycemia while I was lecturing. I couldn't remember what it was 5 minutes ago that I said. I would have lost my job because I could not continue doing this. I was miserable. What price can I put on that? I don't even know how to calculate that. I'm sure there are many lifestyle engineers out there who will tell me, or financial analysts who will tell me what the cost was for that for 7 years. But I'm not even counting that. I'm just counting that cost of what it was hitting my bank balance with. That's all I'm talking about. And now I just take a probiotic. So $20. And even then, if I am using my backup fuelings from Optavia, I don't have to take that either. But let's look at it. Let's, for argument's sake, that I take that probiotic. $20 a month, $240 a year, multiplied by 7, and I still have only what, $1,680 cost for 7 years versus $66,000 plus. What do you think I would have preferred if I had known 7 years ago what my solution was? What would your patient, those of you who are doctors who are listening to this, what do you think your patient would prefer? And those are just direct costs. I'm not even talking about indirect costs, hidden costs. What do you think they would want? So what was this solution that I've been talking about? I was aware that blue before zone was, and then I started the phase 1, like many other diet programs, if you will. But it wasn't just that. I call the diet programs the unicycle. You can ride it for a while and then eventually fall off. But I have this wonderful coach, not just the coach, the entire Habits of Health community, Habits of Health calls, where I learned a lot. and an education system which I learned how my body works and why I was not losing weight and keeping it off, and why my metabolic syndrome was not reversing, how I had to work with my this 10,000-year-old body, if you will, in evolution and making, why I needed to do what I needed to do, why the lifestyle needed to be in a particular way. And then I transitioned once I reached my goal weight, maintained it, living the healthy lifestyle. I learned that I've kept all that poundage off. Not just that, my metabolic syndrome is gone. I take no medications, as you saw. And I did not take myself off. My doctors did. They said, "What did you do? Wow, look at you now." A woman who could not even step on a step stool ran Disney 10K in time to get a finisher medal last year. I'm running 5Ks this year because the booking got over so quickly that I could not book the 10K. Otherwise, I was going to run that this year too. But here I sit, a healthy person today. Why? Because I embrace the lifestyle. The difference of our diet versus lifestyle is what you do when you mess up. Yes, did I mess up in that journey? Yes, I did. Not very often, but I did. But what did I do? I get right back on up because my coach encouraged me to. I had a community, supportive community, which told me, get back on, just stay with the program, embrace this as a lifestyle, eat mindfully, live mindfully, manage your stress mindfully, all of it, be mindful, be present, and we are here to help you. So that's what a health coach is, not a salesperson, but my health coach was my dream builder. I could not even dream of being healthy. I was so depressed. They believed in my dream. She believed in my dream. The whole community of health coaches believed in my dream. And that is why I stand here today. I look what I like to do. Now I know I became a health coach. I can't keep this proven solution to myself. I wish somebody had connected me to this way before that staggering cost of doing nothing or doing all failed solutions. Now you know why I'm a health coach. Now you know. So when are you ready to act? Are you ready? Reach out. Reach out, find a solution. Reach out to me. I don't, I'm not telling you as a coach. I'm telling you as a patient what I needed to do. I so wish somebody had told me the solution. Somebody had connected me. So I am talking to you because I want you not to struggle like I did. So I want you to know that I am not just speaking from a perspective of a um, coach. I'm speaking to you truly from my heart because I want you to know what it feels like to find a lasting solution, find a healthy lifestyle so I can actually do what I need to do. Actually, I could um, be healthy and actually um, talk to you as I am today, healthy, happy, truly happy, not a fake happy smile, but truly happy, living a healthy lifestyle. So that's what I wanted to share with you. I hope this has inspired you to take some action, a really good action to take care of yourself. And you don't have to wait till you have that array of medications by your bedside or in your medicine cabinet. Act when you are that pre-diabetic. Act when you are healthy and want to remain healthy. Thank you.